Hello everyone, and welcome to our latest ASIN guide. Now, if you're an expecting parent, maybe a brand new parent, or honestly just planning for the future, you have landed in exactly the right place today. We're taking a really structured, reassuring look at a topic that, let's be real, brings a ton of joy, but also a pretty healthy amount of anxiety. We're talking about USA newborn care, specifically how parents and medical professionals in the United States handle a baby during those absolute whirlwind first 7 days of life. So, consider this explainer your ultimate stress-free roadmap to reassurance.
Okay, let's dive into this. It's literally the million-dollar question. What actually happens in those first 7 days? Look, bringing a newborn into the world is, well, it's an incredibly overwhelming experience. Your entire life changes overnight, and suddenly, boom, you are entirely responsible for this tiny human. But when we look at how care is structured in the US, we find that there's actually a very deliberate step-by-step system in place. And once you understand this system, that highly intimidating first week, it becomes totally predictable and, more importantly, entirely manageable.
To make it super easy, we've broken this survival guide down into 4 core pillars. 1. The first day in the hospital. 2. The newborn feeding routine. 3. Safe sleep rules. And 4. Hygiene and care.
Section 1. The first day in the hospital. And this brilliantly illustrates exactly what happens right after birth. You see, the hospital is a highly supervised, medically intensive environment designed to make absolutely sure both the baby and the mother are completely stable. The protocol just kicks right into gear. Step 1 is a comprehensive checkup. Doctors are immediately assessing the baby's vital signs. Then, in Step 2, the focus instantly shifts to making sure the baby is kept warm. And finally, Step 3 highlights a really crucial part of the U.S. healthcare approach: parent guidance. Literally before you even leave the hospital, doctors and nurses step in to actively empower you. They teach you how to safely hold, feed, and protect your newborn. It's kind of like an immersive training camp on day 1.
Now, during all this, doctors emphasize a vital rule. Skin-to-skin contact with the mother is incredibly important. Right after that initial medical checkup, the staff strongly prioritizes this direct physical connection. And it isn't just a sweet bonding moment, right? It has profound medical importance. It actually helps regulate the baby's body temperature, it stabilizes their tiny heart rate, and it provides this immense, deep emotional reassurance to both the baby and the parents after the sheer stress of birth.
Section 2. Newborn feeding routine.
So once you leave that highly supervised hospital environment and finally head home, feeding very quickly becomes the single most demanding daily routine you're going to face. There are 2 primary paths here, and I want to be clear, both are fully supported. In the US, the medical preference definitely leans heavily toward breastfeeding. It's highly encouraged by pediatricians, especially for the first 6 months. However, if a family chooses or needs to use formula, the approach becomes highly structured. Doctors will actually provide a strict, tailored feeding schedule for you. The big takeaway here is that whether you go the organic route of breastfeeding or the structured route of formula, you are given crystal clear, professional guidance, so you know the baby is getting exactly what they need.
Now, if you take nothing else away from this section, please remember this number: 2 to 3. This is the absolutely crucial interval for survival in that first week. A newborn baby's stomach is just incredibly tiny. We're talking about the size of a cherry on day 1. Because of this, they process food very quickly, and they need to be fed every 2 to 3 hours. And yes, unfortunately, that means around the clock. Whether it's 2 p.m. or 3 a.m., that 2 to 3 hour rhythm, that is your new clock.
And while you're feeding them constantly, doctors also teach a very specific balancing act. You really want to avoid overfeeding, because that can lead to discomfort and spit up. And equally importantly, always remember to burp the baby after a feed. Newborns swallow a lot of air while they eat, and simply taking a moment to gently pat their back to release that air is a vital technique. It keeps them comfortable and stops them from becoming incredibly fussy.
Section 3. Safe sleep rules.
Guys, I literally cannot overstate this. Safe sleep guidelines in the US are incredibly strict, deeply researched, and absolutely vital for your baby's well-being. Let's run through these rapid fire, because in the US medical community, these are non-negotiable safety rules. First, back sleeping only. Always place the baby flat on their back to sleep. Next, the crib should be simple, clean, and most importantly, completely empty. No way should there be pillows, and absolutely no heavy blankets. Just a firm mattress and a fitted sheet. You also want to keep the room at a normal, comfortable temperature so the baby doesn't overheat. Visualizing this is super easy. An empty crib is a safe crib.
So the crucial point is no sharing the same bed with parents. Now, this often represents a major cultural difference. We know that in many cultures around the world, sleeping in the exact same bed with your newborn is completely standard practice. However, U.S. doctors firmly, vehemently advise against co-sleeping due to the specific safety risks it poses to the infant. They highly recommend that the baby sleeps in the same room as you, for sure, but on their own dedicated safe sleep surface like a bassinet or a totally empty crib.
Section 4. Hygiene and care.
Okay, you've made it through the hospital, you are feeding them around the clock, they are sleeping safely. Now comes the daily maintenance phase of home care. And that brings us to another highly important, slightly terrifying number, 8 to 10. That is the staggering number of daily diaper changes parents will face in just those first 7 days. Honestly, it is essentially a part-time job just changing diapers. And because of the sheer volume, U.S. guidelines recommend using high-quality, skin-friendly wipes and very gentle products just to protect the newborn's incredibly sensitive skin from irritation.
Now, what's really interesting about this slide is how this routine actually relieves a lot of parent pressure. When we contrast the relentless daily task of diaper changes with the weekly tasks, you'll notice the bathing schedule. You actually do not need to bathe a newborn every single day. In fact, 2 to 3 times a week is completely enough. Doing it more often than that can actually dry out their skin. And during this first week, you're mostly just doing gentle sponge baths anyway, while waiting for the umbilical cord stump to naturally heal and fall off. So it's a surprisingly low-maintenance bath routine that finally gives exhausted parents a much-needed break.
So, we've covered the highly structured hospital protocols, those endless 2 to 3 hour feeding intervals, the strict rules for a completely empty crib, and of course, the absolute mountain of 8 to 10 daily diapers, which really just leaves us with a final big question. Are you ready for USA parenting? You know, breaking it down into these 4 structured pillars really makes the impossible feel pretty doable, doesn't it? Thank you so much for joining me for this Malamati Jalak. Make sure to subscribe to explore more about the USA lifestyle. Keep preparing, and I will absolutely see you next time.